Thank you, Sushuan. We move on to the lecture proper. Of course, it's my pleasure to thank the sponsors, but we would like to make note that the CPG is published by the Ministry of Health and that what is inside is not influenced by the sponsors. To introduce this, I asked one of my colleagues after this came out, what did he think? What did he think of the CPG? He said that it's like the sayings of Confucius. Now, if you're from K Hall, that doesn't mean that it's a book of wisdom. It means that it's confusing, and it is indeed confusing because rhinosinusitis is a controversial subject, and definitions only came in 1997. Yeah? Chronic rhinosinusitis defined only in 2003, and although it has been with us from time immemorial, the scientific basis for rhinosinusitis is relatively new because without a definition, you cannot write a paper. And so we went through various papers, American ones, the European one, and we have within our work group very important, talented person, Professor Wang Deyun. Yeah? Wang Deyun is a Singaporean, but China-born Singaporean, and is the only Asian in this EPOS, the European Position Group, and he helped us a lot with the formulation of many parts of the CPG. So we have a work group, and we did the CPG, and first, I'd like to comment something about levels of evidence and grades of recommendation. Actually, it depends on the local context, etc. Yeah. For example, if a tourist were to come to a hawker center, you look at this, you will think that fruits are better than wonton mee. Yeah? But you know that's not true, and that's because the Ministry of Environment uses cleanliness, and we also know locally that D grade doesn't mean it's no good. It could be still better food than A grade. So let me tell you the story. You see, this comes from Bala. Now, if you have foreign body in the trachea, you will go, if you're in America and you're in trachea hospital, they'll put a bronchoscope and take it out. Yeah? And this is level 2. This is based on case study, yeah? And grade B recommendation because based on case studies you get a recommendation. Then Bala told me that we were trapped in Ho Chi Minh City for a few hours, so he told me this story. He went to Laos. In Laos, because they don't have a bronchoscope, if you had a foreign body in the trachea, they will cut open your trachea to take it out. Yeah? In Singapore, you sue them. Yeah? In America, you sue them. But there, this is the best, and it saves the life. Yeah? And so levels of evidence and recommendation depends on locality. So we in Singapore, we are more close to America, so we follow European, American recommendation. Yeah? So we are lucky here. But in Laos, it works. Yeah? And Bala tells me the surgeon has a proud collection of all the FBs he has removed from trachea through a tracheostomy. Yeah? Let's come to, if rhinosinusitis is confusing to define, let's go to the cellular level. And this comes from Professor Steinberger's book. Steinberger, very important with sinusitis. The book cost $450 when I was a registrar, and that was almost 15% of my pay. I bought the book and then I didn't read it because, you know, when you buy a book, you keep it, you know where the knowledge comes. But anyway, you look at the pictures. So the cells in the nose, they move. Yeah? You form mucus, and the function of the cells is to move the cilia. It moves the mucus over areas, over bony areas, etc. And it moves it towards the back of the nose. And Steinberger's book defines the movement of the mucus. Yeah? Since I'm the chairman, so I will show you my book too. I wrote a book too. Yeah? So my book is more on anatomy. Yeah? So the whole function of the nose, part of the function of the nose is that mucus must flow. It must flow correctly into the back of the posterior space. And it does so through very tight, narrow passages. Yeah? And there's a gel that's flowing all the time. Yeah? And so the patient says in the morning he has this and there's something there. It's because in the daytime we talk, we swallow, we are not aware. In the night, if he doesn't talk in his dreams, then there's a bit of mucus in his nose. Yeah? In the morning he does that. It's okay, it's normal. Yeah? You explain to that way it's fine. Yeah? So this is the most important style of all. Okay. The fact that we say rhinitis, allergic rhinosinusitis. Itis means inflammation. So through all that we know there is inflammation, and the inflammation manifests in different ways. Yeah? It can manifest as a acute sinusitis. When you have a viral sinusitis, you have a common cold, yes, you have acute sinusitis. Yeah? It can manifest as an allergic rhinitis. Yeah? Allergic sinusitis, allergic rhinitis. It can then come together and become chronic and become nasal polyposis. So all these are interchangeable. Something triggers them and they become that, and we are still trying to find out what it is. Yeah? So of course then it's itis, inflammation. So what is good for inflammation? There are 4 sponsors out there which are steroid companies, so you know what's good for inflammation. Yeah? So this is an important diagram. Yeah? Remember it. It's a standard diagram because here is something which you have more experience than I do. Patients with an upper respiratory tract infection. When they have a viral URTI, we don't know when it's going to become bacteria, but we know that within 5 days, most viral URTI are going to get better. Yeah? Ministry of Health said in the CPG, please tell the doctors when not to start antibiotics. Yeah? So try not to start antibiotics around here. I know sometimes it's competition. Yeah? The other side is going to give antibiotics. You don't give, I'm going to the other doctor, that kind of thing. But no, you got to stop them. But there's a reason. Look at this slide. You see, in France and Spain and Portugal and Belgium, the doctors give lots of antibiotics. Fine, they just give it. No problem. They just give you. And you will look at, these are the sales. So what can we give them? If it is within 5 days, if it's not more than 5 days, you know a majority is going to get better on its own. Yeah, you may not need any treatment, maybe vitamin C, something symptomatic. Yeah, but beyond 5 days and before it gets to a time when we feel that there's going to be bacterial infection, there's something we can give. Yeah, and it makes sense. You look at this paper, we are talking about inflammation. So viral inflammation will respond to steroids because the inflammation is an effect of the problem. Yeah, and mometasone has one study. This is the only study so far where it shows that if you give mometasone twice a day from the 5th day of the URTI, or you will give antibiotics, yeah, or you give a placebo, based on symptom scores and improvement, there's a marked improvement for patients given mometasone twice a day, but not once a day. Yeah, once a day is for allergic rhinitis, twice a day for viral inflammation. The only thing against this is that mometasone is more expensive than ampicillin. So mometasone guys will be giving you smaller bottles. And of course, one other thing is the CPG is not cast in stone. Yeah, it can be updated on the web. Only the 10 commandments is cast in stone, but this is updated in the web. So we have on page 33 something on long-term macrolide therapy, and it says that when you use low-dose macrolide therapy, it has been beneficial in chronic sinusitis. Yeah, and it appeared that all these papers came from Japan. It was almost 10 years ago. So I wrote that it's for Japanese. Yeah, which we have changed it here because we have put in a new thing because there's new evidence. In selected cases, it does work when topical steroids and short course of antibiotics fail. Yeah? And this came about because we were having a discussion in Ho Chi Minh City recently, and as you can see, whenever there is a management of rhinosinusitis and you have a Yanagis from Japan, it will be about macrolides and the Japanese. Yeah? Okay. But Prof Wang also presented studies, and these studies from around the world have also adopted the Japanese way of giving macrolides for chronic sinusitis, because we have a problem treating chronic sinusitis. And from Brisbane, Australia, and from Cairo, Egypt, they also show that these patients do respond with a long-term low-dose macrolide. And it works not by its antibacterial activity, but it has got something to do with immune modulation. And these are the two important things that I will tell you about. Yeah. Thank you very much.